you everyone for joining us. I'm Anna K. Izagiri. I'm Communications Director with the Committee to Protect Healthcare. We appreciate you being here during a very busy week. We are joined today by physicians across Wisconsin who will be sharing what a Tom Tiffany governorship could mean for healthcare in the state. Before we begin, I want to note that the physicians speaking today are doing so as individuals and with the Committee to Protect Healthcare, not necessarily on behalf of any employers or other affiliates. So we please respectfully ask that you only refer to them in any coverage as they introduce themselves and not include employment information unless they expressly share that. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. Dahl Winther.
Hello, thank you for inviting me to participate in this important discussion. I am Dr. Kristen Dahlwinther, and for 22 years now, I've been a Wisconsin physician board certified in family medicine. I'm also a constituent of Congressman Tom Tiffany. On Tuesday, Tom Tiffany won the Republican primary for governor. That means Wisconsin voters are now going to hear a lot more about the kind of governor he says he wants to be. As physicians, we have a responsibility to make sure they also hear about the health record he has built as a member of Congress. I see firsthand what happens when patients struggle to afford care, when rural hospitals are under financial pressure, and when people put off seeing a doctor because they are worried about what it will cost. Tom Tiffany has repeatedly voted for policies that make those problems worse. For example, he voted for H.R. 1, which slashes Medicaid funding and could push as many as 258,000 Wisconsinites off their health coverage. Those cuts also put additional financial pressures on our local rural hospitals, which are already operating on very thin margins and now at risk of closure. In many communities in our state, like mine, we don't have several hospitals to choose from. Should our local one close, that local one is it. That's the place where people go when they are having a heart attack, when their child is critically ill, when a pregnancy becomes complicated, or when they need emergency care in the middle of the night. Tiffany also voted against extending the Enhanced Affordable Care Act tax credits that had helped Wisconsin families afford their insurance. When those subsidies expired, premiums in Wisconsin rose by more than 50% on average compared with 2025. What that translates into is real families who are forced to choose between paying an insurance premium and paying for groceries or their rent or prescriptions. Many of them are understandably going without insurance. Now, I practice at a clinic that offers primary care without insurance for 8 cents on the dollar. And as such, I'm able to deliver about 80% of the care that my patients need. It's their lack of access to the other 20% that keeps me up at night. My patients with fractures who settle for casting, resulting in chronic pain and disability because they can't afford the standard of care surgical repair. My patients with asthma who quickly go downhill when they encounter an allergen or a virus because they can't afford their steroid inhalers. My patients with precancerous polyps crossing their fingers that they don't develop colon cancer before they turn 65 and Medicare kicks in because they're years overdue for a colonoscopy they can't afford. And my patients who end up in the hospital with life-threatening conditions and then have to deal with the stress of a $100,000 hospital bill they can't pay while they're trying to recover. Before November, Wisconsin voters deserve to know what Tiffany's record means for their health care. As physicians, we owe them that honesty. So I hope every Wisconsin voter will see beyond the campaign rhetoric and look at what Tom Tiffany has actually done to our state. His record tells us exactly what kind of healthcare policies he would bring to the governor's office. Now I'd like to introduce Dr. Kramer.
Thank you so much, Dr. Dahlwinther. I have practiced internal medicine in Wisconsin for 35 years. Outside of my medical practice, I regularly advocate for health policy, and I know that our next governor will play an important role in how people in Wisconsin will be able to access affordable health care, as well as to exercise the freedom to make their own medical decisions in consultation with their doctor. Tom Tiffany's record on Medicaid and ACA tax credits are deeply concerning. because so much of what we do depends on patients having consistent access to health care. I treat patients with chronic diseases like diabetes, cancer, heart disease, hypertension, and those don't disappear when someone loses insurance. They just become harder to manage. I've seen too many patients suffer from treatable conditions simply because they didn't have access to affordable care. I recall Jack, who owned his own home repair business and couldn't afford insurance. He went to the hospital for his heart attack, and a stent prevented further damage, but he got scared about the medical bills, so he left the hospital prematurely to go back to work, but without the medications needed to keep that stent open and functioning. Then there is Vicky, who had difficulty keeping steady employment because she had responsibilities as a family caregiver. She had a rare but treatable condition that we could manage with medication when she had employer-sponsored insurance. But when she lost coverage, she couldn't afford the medication and she would use emergency room care to stabilize her serious symptoms. In the end, this was harmful to her and more expensive for all of us. Access to affordable care makes human sense and economic sense. We are seeing the tip of the iceberg of the costs Wisconsinites will pay for the irresponsible cuts that Tom Tiffany voted for in supporting H.R. 1. Already, my patients are contacting me about stopping effective treatments or foregoing therapy that keeps them independent because they're losing coverage. But these aren't the only aspects of Congressman Tiffany's healthcare record that are concerning to me. His record on reproductive health care is deeply troubling. We all remember what happened when the Dobbs decision overturned Roe v. Wade and took away the federal right to abortion. Wisconsin's archaic and cruel abortion ban went into effect, risking women's lives and trampling on their reproductive freedom. Tom Tiffany could have voted to protect that federal right to abortion in law, but he voted against it, allowing state bans like ours to interfere in personal medical decisions. Congressman Tiffany even supported a ban on abortion after 6 weeks with no exceptions. That is extreme, plain and simple. He may be trying to soften his tone on abortion now, erasing it from his website, but we haven't forgotten what he supported. I'll never forget what it was like for doctors and patients when Wisconsin's abortion ban went into effect in 2022. We were afraid to talk to patients, even about their pregnancy status. My colleagues in OBGYN had to scramble to direct patients to get care in other states for their pregnancy complications. We saw doctors and nurses deciding to leave Wisconsin due to the restrictions on reproductive care. Doctors understand that reproductive health decisions can be medically complicated and deeply personal. They should be made by patients in consultation with their physicians, not dictated by politicians. Tom Tiffany's record raises serious questions about whether he would try to dictate women's medical decisions. Our next governor will influence health policy on our freedom to choose effective vaccines as well. This week, we saw the Trump administration issue a bizarre executive order that proposes to upend vaccine policy with recommendations for vaccines that don't exist based on fear and fiction rather than science. While this doesn't change what is available to patients right now, it is important to realize that states play the primary role in vaccine policy. We need a governor who will support policies that let the people of Wisconsin choose effective vaccines based on the advice of trained medical professionals, not political rhetoric. Wisconsin voters deserve to understand how our candidates for governor will create and implement policy on access to affordable care, reproductive health care, and vaccine policy. And physicians have a responsibility to make sure they do. I'd now like to introduce Dr. Friedland.
Thank you, Dr. Kramer. Thank you, Dr. Dahl-Winther, and thank you to the Committee to Protect Healthcare that has been an advocate for patients and healthcare access for many years. I'm a retired physician now, so I have a little bit different perspective. I spent 38 years practicing medicine in Wisconsin from Sheboygan to La Crosse, so I've kind of been on both sides of the state. I do believe that retired physicians also have the obligation to speak up when policies threaten our patients' health and access to care. And Tom Tiffany's policies have done just that. It's no wonder he's trying to downplay them, but we won't let him. We're reminding Wisconsinites that just because he's removed his anti-abortion views from the website, he's an extremist. And while his website now says that he wants to cut burdensome regulations to make healthcare more affordable, his votes have just done just that. As my colleagues have mentioned, he voted for H.R. 1, making the biggest cuts to Medicaid in the program's history. Medicaid is health care for some of our most vulnerable neighbors, low-income families, moms, children, seniors, and people with disabilities. More than 250,000 of these neighbors in Wisconsin alone could use their health care because of the cuts Tom Tiffany supported. And I recall during my many years taking care of people's eyes as an ophthalmologist, we took care of many patients. Seniors had glaucoma that didn't know they were losing vision and would, without healthcare access, would continue to go blind. We took care of many children. We don't think of children often, as far as their problems, that have amblyopia, that have lazy eye, that without intervention, they also go blind and usually in one eye or the other. We have patients that have cataracts that without access to healthcare will continue to drive and pose a threat to themselves and others on the road. There's many things that we lose when patients don't access healthcare properly. We know that maybe they don't go to the doctor, but disease does continue anyway. More than a quarter of people in Wisconsin could lose their health care because of the cuts that Tom Tiffany has supported. Here in Western Wisconsin, we know how important Medicaid is, particularly for rural communities. Rural hospitals are already struggling financially. Cutting the number of people who have coverage means putting additional financial strains on the hospitals and clinics that serve them. Our hospitals and clinics are obligated to care for people who come in with acute problems. But without coverage, without health insurance reimbursement, these hospitals and clinics are put at risk. But that's not the only financial strain Congressman Tiffany is responsible for. He voted against extending the enhanced premium tax credits for affordable health care, the ACA health plans. Now, healthcare deductibles have surged to record highs in Wisconsin, increasing more than $1,000 on average, and the costs of those policies have soared as well. That's a lot of money for most families, and many Wisconsin families are just giving up the insurance because they need to eat. They need to pay for the gas, which is getting more expensive, and their own costs are going up every day. So now families are having to make tough decisions about budgets. That means letting go of their health care for many. Thousands fewer Wisconsinites signed up for ACA plans this year than last year, at least 17,000 less. They just have to hope they don't get sick or injured, but hope isn't a medical cure. It didn't have to be this way, but Congressman Tiffany voted it to be this way. Tom Tiffany has shown voters what he supports and what isn't important for him. Before November, Wisconsin physicians have an obligation to make that record clear so voters can decide whether it represents the future of healthcare that they want for Wisconsin. Thank you very much.
Thank you so much, Dr. Friedland, Dr. Kramer, and Dr. Dahlwinther. We'll now open it up for questions. If you have a question for one or all of the physicians, please feel free to ask that. You can type it in the Q&A or the chat box, or you can raise your hand and I can allow you to unmute to ask your question verbally. So we will allow a few moments for folks to be able to ask those questions or raise their hands. You've got one in my chat. I'm going to share with you all and I'll read. Have you already noticed impacts on rural hospitals and clinics due to HR1? That's for any of you. Again, that's have you already noticed impacts on rural hospitals and clinics due to HR1?
I can just speak to that a little bit. So I practice at a private clinic that I own. And so because I operate outside of the insurance-based system, a lot of my patients are patients who are uninsured or very underinsured. And so access, to care has always been an issue. I think it's important to point out that even before HR1, our healthcare system was struggling greatly. I remember in the year 2000, as a first-year medical student, marching on the Capitol in Madison, advocating with my fellow students about the importance of universal access to healthcare, because what the HMO, based system was presenting us was already kind of doomed for failure in a lot of our opinions. And so, we weren't starting from a good place. What I see now that's affecting all patients, insured or not, are services that are leaving the areas. So, we lost Prevea Healthcare recently. A vein clinic left. Obstetric care is very difficult to find. Patients often have to travel an hour to find a delivering provider. I do prenatal care up until 28 weeks, but can't afford the malpractice coverage beyond that. And so we've managed to kind of shift together this system that's kind of working for now, but really needs a lot of improvements. Staffing shortages, patients of mine that are nurses that are now having to care for 6 patients on their acute care floors because of funding cuts that are leading hospitals to try and figure out how they can keep the doors open. And how that often ends up being managed is by decreasing staffing, which increases the risk and patient safety concerns for patients who are accessing that care. And so it's just a boulder that picks up speed going downhill, the more and more hits to the system that come in. And it really is a very tenuous situation right now. It's very difficult for patients to get high quality, high value care in America.
Thank you, Dr. Dahlwinther, and thanks for your service in a rural area and for finding a way to provide care to those who are struggling with access. Um, I practice in a more urban area, but I am part of several professional groups that are statewide. And I think we do know that there's lots of data that when people lose insurance, hospitals, emergency services that are much more expensive do spike, and that puts a real strain on those networks of care. So we are actively monitoring. I personally am beginning to get calls from people who are um, getting letters or calls that Medicaid services, that they're losing Medicaid services. We, I think, are bracing to see the full impact on that in months to come. And I think throughout the state, we're very worried, but we know that the rural healthcare networks are highly vulnerable.
Thank you both, and thank you for that question. I had another question chatted to me that I love because I've been loving this video. A CNN interview with Michigan Congresswoman Haley Stevens yesterday has gone viral after she claimed Tom Tiffany is obsessed with hunting wolves at the expense of dealing with real issues impacting Wisconsinites. How would you respond to the claim that Tiffany is ignoring the real issues? And that's for any of you.
Well, I think as one of his constituents, he just ignores the real issues. I mean, you look at his voting record, and he clearly is concerned with pleasing the president and not with actually meeting the needs of his constituents. I think I personally have called or written his office half a dozen times in the last 6 months or so and have heard nothing in response. And there's no action on the ground. I don't see him talking about healthcare policy. What are the solutions that you're proposing? It's a bunch of talk and not a lot of action to follow. And so I haven't seen the video about him being obsessed with hunting wolves, but it doesn't surprise me in any capacity whatsoever.
I would add that I've been very busy taking care of patients, so no, I have not seen viral social media clips. Um, I do. So I was in DC with a physician group a couple of months before HR1 passed, and it was very discouraging that we were hearing a lot of rhetoric about parsing words and just not really looking at the reality of how this was going to impact people. I so I think the real issue has been ignored from the get-go when HR1 was introduced, and the real tragedy we're seeing of the impacts of it. I think, people absolutely need to be, the politicians who supported that need to be held accountable.
If I could just briefly add, and not being a actively practicing physician, I sit, speak as an observer too. Certainly, HR1 is gigantic, um, with people losing health insurance and access and uh, Medicaid cuts. Hospitals, we didn't really discuss that there's cuts going directly to rural hospitals besides what patients having to do with reimbursement formulas that are complicated. Um, but there's also the issue of vaccination. We have a measles epidemic in America. We thought that measles was history, and now we have doubts placed among parents about whether they should vaccinate their children. We have the president advocating splitting up MMR vaccines. He says he wants to simplify things, but he's going to make it more difficult, so there'll be less kids that'll get vaccinated for measles in America. Uh, we have a failure to deal with um, Ebola, where the undermining of medical research that I haven't heard Tom Tiffany talk about, the undermining of the CDC, even the attacks on Dr. Fauci, very political, who was involved in dealing with HIV epidemics, Ebola epidemics, and as I recall, that Dr. Fauci received a medal from President Trump at the end of his first term, I believe, among other recognition. But there's just a general undermining of science, about undermining of medicine, undermining of trust with your physicians, where your doctor has to say, you need to get your child vaccinated, and people have vaccination doubt. Even when there's a question of autism. There's no evidence of any connection with autism and vaccination. And I haven't heard Tom Tiffany say anything about that. So the problem is complicated. Tom Tiffany walks in lockstep with President Trump and has really refused to distance himself. So I think there's a general problem with Tom Tiffany and healthcare in Wisconsin. I hope that answers that question.
I think so. I'm not seeing any follow-up questions. Um, we'll allow another moment or so. In the meantime, I'll say we've been recording this, so if you'd like a copy of the recording, let me know in the chat or at the email address where you RSVP'd, and I can get the recording over to you shortly. Yeah, not seeing any additional questions, so we'll go ahead and wrap up today's call. Thank you everyone for joining during, again, a busy day, busy week, election season. And thank you so much to our speakers, Dr. Friedland, Dr. Kramer, and Dr. Dahlwinther. We appreciate your time and your advocacy on behalf of all Wisconsinites. Thank you. Have a good afternoon, everyone.